Welcome to the Dr. Geo podcast. I am your host, Dr. Geo, where it is my goal to share with you some insights as it relates to helping you with urological conditions and overall how you can live better with age. Today's podcast is about erectile dysfunction, ED, and what can we do about it? Overall, let me say this. It used to be that the primary type of person that comes to the office with ED was an elderly person, let's just say above 50. I've seen a great deal of men younger than 40 with erectile dysfunction coming into my office. What's that about? First thing, a penis is a man's barometer to indicate how his overall health is. For example, if I have a man come to my office and he hasn't had an erection in 3 months, red flags are going up in my head. So it's very important for men to get erections for their whole life. The only exception to that rule is men that get medically treated for prostate cancer, whether it's a prostatectomy or sometimes even radiation. So you need to have healthy nerves and you need to have a healthy bloodstream. So anything that causes problems with nerves or blood vessels would cause erectile dysfunction. So why do men under 40 are experiencing ED? So technology increases stress for a lot of people. If you're constantly, reeling and looking at social media, you're trying to figure out how you're not enough. You're not good looking enough. You don't have enough money. Your penis is not big enough. It's just constant reminders of how you're not enough, and that's stressful. I think that the stress from watching too many things on your devices is a problem, a stressor, which causes ED or contributes to ED, I should say. Watching excess porn contributes to ED. I would say that's probably the number one factor. And then just stress in general. Let's talk about the psychological component of ED. The most important organ and the number one organ for healthy erections is your mind. In order to have an erection and maintain an erection, you have to be all in the bedroom. 50% of your mind can't be at work and the stresses that have to do with work. You have to be immersed and engaged in sexual activity when you're about to have sexual activity. The psychogenic components and the excess porn watching is the primary factor why men under 40 are having ED. So if you were to ask me, Dr. Gio, what's the number one disease that causes all kinds of other problems? I would say diabetes. Diabetes type 2 contributes to hardening of the arteries and plaque formation of the penis. So cardiovascular disease, if your heart is not healthy, you can't pump enough blood to these little arteries of the penis. So how about from a neurological perspective, the nervous system that contributes to erections? Well, some people can have multiple sclerosis, right? Parkinson's disease is a contributor for ED. What can we do about erectile dysfunction? Here's the deal. There are numerous things. There is just acknowledging that the mind is so important and powerful for sexuality. I think just that's 50% of the battle. Stop watching things and excess things on TV. And even if it's not porn, just excess, these devices, we have more exposure to negative things that we're consuming. And that penetrates our minds and our subconscious mind. The medical treatments for ED, as you know, are Cialis, Viagra, Levitra. I have no problems with it, but here's what you may not know. Oftentimes, when people use, let's just say Viagra or Cialis at high dosages, the feedback that I get is from a lot of men is the penis feels a little bit desensitized. It's almost like the nerves of the tip of the penis are sort of asleep. So you're just kind of going through the motions, but you're not feeling much of anything. So you have to play around with the dosage. Again, treat the cause. Don't be foolish. Something else is happening, and you don't want to be dependent on it. You shouldn't have to be. There's studies that show that men after, who start losing weight and exercise and eat right, they start getting erections. one of the ways you know if things are moving in the right direction is morning erection more often than not. What are the natural approaches? Well, nothing is more natural, again, than exercise, a good diet, losing some weight and body fat if you're overweight. The goal is to keep the arteries healthy. Anything that keeps the arteries healthy is good for erectile dysfunction. Anything that's good for the heart is also good for erectile dysfunction. So, in terms of botanicals and herbs, my favorite category of herbs at this moment in time for erectile dysfunction is called adaptogens. These are herbs like rhodiola, ashwagandha, ginseng, cordyceps. So other nutrients that support arterial health include resveratrol and pomegranate extract. They work very well. So that's the story with erectile dysfunction. Look, sexuality is an important component to quality of life. It's not everything, but it's a nice thing. It's an important thing for quality of life. And I think that many men, even after prostate surgery, can successfully get an erection. Okay, so this is my podcast today on erectile dysfunction. I hope it's useful to you. I'll see you next time. This is Dr. Gio signing off. Thanks for tuning in to this week's episode of the Dr. Gio podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel on youtube.com/Gio Espinoza ND. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgio.com. I'll see you next time. And now for a brief disclaimer. This podcast is for general information only, and we're not forming a doctor-patient relationship through this medium. The use of the information and all links associated with this podcast is at the listener's risk and is not to replace medical advice from a physician or a healthcare practitioner. Lastly, thoughts and opinions related to this podcast are my own and may not reflect the views of any institution or organization I'm associated with.